morning. Here I am sharing some basics on pancreatic cancer. What is pancreatic cancer? Pancreatic cancer happens when normal cells in the pancreas change to abnormal cells and grow out of control. The pancreas is an organ that sits behind the stomach and it makes hormones and juices that helps the body to break down food. What are the symptoms of pancreatic cancer? Symptoms of pancreatic cancer can include pain. You can have pain that spreads from your stomach area around to your back. The pain can come and go, and it can get worse after eating. Weight loss. People might not feel hungry or might feel a full stomach after eating very little. Diarrhea and bowel movements can look greasy or be difficult to flush in the toilet bowl. Yellowing of the skin, called jaundice. Both skin and the white part of the eyes can turn yellow. When jaundice happens in people with pancreatic cancer, it is usually because one of the tubes that carry that is a product of liver, bile from the gallbladder to the intestine is blocked. The gallbladder is a small pear-shaped organ that stores bile, a fluid that helps the body to break down fat. And if a bile duct get blocked, it can also cause your bowel movements to look gray instead of brown. And these symptoms can also be caused by conditions that are not pancreatic cancer. And if you have these symptoms, tell your doctor or nurse about them. Is there any test for pancreatic cancer? Yes. If your doctor suspects you have pancreatic cancer, they will order one or more of the following tests. These can include blood tests, some imaging tests. These might include an ultrasound, a CT scan, an MRI scan, or a test called ERCP, which stands for endoscopic retrograde cholangiopancreatography. And these tests can create pictures of the inside of the body and can show abnormal growths. And biopsy. For a biopsy, a doctor takes a small sample of tissue from the pancreas. Then another doctor will look at the sample under the microscope to check for cancer. Now, what is cancer staging? Cancer staging is a way in which doctors find out how far a cancer has spread. The right treatment for you will depend a lot on the stage of your cancer, and your treatment will also depend on your age and other medical problems. How is pancreatic cancer treated? People will, with pancreatic cancer might be offered one or more of the following treatments. Surgery. Pancreatic cancer can sometimes be treated with a surgery to remove the cancer. Before surgery, doctor might do a procedure called laparoscopy. In a laparoscopy, a doctor will make small cuts in the belly, and they will put a thin tube with camera on it inside the belly to check whether there is spread of cancer out there to pancreas. Chemotherapy, and this it's a medical term for medicines that kill cancer cells or stop them from growing. And you can use radiation therapy, which kills cancer cells. And now novel therapies like immunotherapy, this is a term doctors use for medicines that work with the body's infection fighting system, that is the immune system, to stop cancer growth. Pancreatic cancer can sometimes be cured with treatment, and this is most likely in patients whose cancer is found at an early stage. Even if your pancreatic cancer cannot be cured, your doctor can treat your symptoms. For example, they can prescribe medicine or a procedure called celiac plexus block to reduce your pain. What happens after treatment? Following treatment, you will be checked every so often to see if the cancer comes back. Follow-up tests usually include exams, blood tests, and imaging tests. If the cancer comes, if the cancer comes back after treatment, you might have chemotherapy, radiation therapy, or immunotherapy, and you might also get pain medicines or other treatments to help with pain. What else should I do? It's important to follow all your doctor's instructions about visits and tests. It's also important to talk to your doctor about any side effects or problems you have during treatment. Getting treated for pancreatic cancer involves making many choices, such as which treatment to have. And always let your doctor and nurses know how you feel about a treatment. Anytime you are offered a treatment, ask, what are the benefits of this treatment? Is it likely to help me live longer? Will it reduce or prevent symptoms? What are the downsides of to this treatment? Are there other options besides this treatment? And what happens if I do not have this treatment? Thank you.